the first picture that you're seeing, this is a foster cat. I'm part of a no-kill shelter here in Iowa, and this guy came to me because he was a bit feral and he needed some socialization before he'd be adoptable. Couple of months in of having him, he started losing weight. Being as he was a cat that I couldn't handle, it made it difficult on how I could treat him. However, I did all the things that I was trained to do, different diets, remove things from the room, that sort of thing. Nothing really worked. So I took him back to the shelter to have blood work done, have the veterinarian look at him. He was ultimately diagnosed with GI lymphoma. It's a form of cancer that is common in cats. They eat, as you can see, this guy here, he is eating. He never stopped eating, but he continued to lose weight. So in the picture you're seeing, you can see how skinny he is. Those are his ribs and his rib cage. So he literally was nothing but skin and bones. So this was the day I brought him back home from the shelter after he was diagnosed. Now, after he was diagnosed and sent back home to me, he was more or less with me for hospice type care. So I figured, what's the best way to make him comfortable? I gave him the food that he likes. So I didn't, try to narrow his diet or anything, gave him what he wanted. The picture you're seeing now is, of course, where he's being patched. And I patched him during the day with glutathione, and then he got my X39 at night when I was done with it during the day. So he was with the X39. The difference between the two pictures, the first picture was on July 27th. The picture you're looking at now was August 6th. So you can see he no longer has his rib cage showing. You can't see his ribs. He was starting to put weight back on. And then, from that picture, that was the day I brought him home, nothing but skin and bones. He literally was nothing but skin and bones. The hair loss is a stress coping mechanism for him. He pulls out his own hair, did when he was healthy before he got sick. So don't concern yourself with that, but the fact that he was just thin. And then Beamy, the third picture, this was today. As of 10 days ago, he weighed 8.5 pounds. That very first picture, he was 5 pounds. So in just a short amount of time since July 27th, up to 10 days ago when we weighed him, he was 8.5 pounds. So he's probably 9.5 pounds now, and getting back to his about 12 to 13 pound ideal weight. So he still is getting patched every day and getting his chicken every day and all of that. Now this one that you're looking at here, this one is an x-ray of a kitten. This was an extreme case of cruelty where the owner threw her down and stomped on her. And so what you're seeing here on the left side is a normal, healthy ball and socket joint. On the right side, what you're seeing is the crushed socket. So she could not bear weight on that leg. She couldn't, she walked as a tripod because she held that leg up. And with her, I actually have her. Come here. She is now healthy. This is her. Aww. She jumps and does everything. She is available for adoption. She is completely healthy. For her, what I did is I patched her with the X39 at the base of her tail. And then because she didn't do well on her pain meds, I put the ice wave on either side of her hips. And that helped her to not be in pain so she could rest and not cry. And then the X39, of course, then helped her to heal. So she is now available for adoption. Now, when that happened, I received her on May 3rd. And as of a month ago, she was cleared by the vet, but we kept her not available for adoption yet. We just wanted to give her that extra 30 days to continue healing because it was such a severe fracture. But so she is doing great and is available for adoption now.
Awesome.
So those are my two cats. Both of those are my fosters. My dog 4 days in after I started the patches, which was back in early April, I couldn't bring myself to throw away the X39 after I took it off me at night. So I stuck it on my dog. He's a Beagle mix, and he's geriatric, so he has kind of muscle and joint issues. So I thought, this could help him. Well, what it helped him do was hear me. He was virtually deaf prior, and 4 days after wearing the patch, he got it at night. He could hear me again. His hearing isn't completely there yet. I mean, he's still an elderly dog, and he still gets the X39 when I remember to give it to him, because I've got so many that I'm dealing with. But he is hearing me again. So there's that. And then another dog who we call a foster failure. He was a foster, another cruelty case. He was bitten by another dog in the home, and the owners failed to seek treatment for him. So he was recovered by the police from the home, and his puncture wound was through his neck and into his esophagus. So anything he ate actually came out the hole in his neck. So it was really gooey, really gross, gnarly, whatever. But because they failed to get him treatment, the infection festered up into the side of his face. So the side of his face was swollen, aside from the puncture wound. So for him, what I did is I put an Eon on his face to help with the inflammation. I didn't like giving him the pain meds, so I put the ice wave on him on either side of his head. And then I put the X39 directly above where the puncture mark was. And I tried to get these pictures to you, and they wouldn't come through, but they show such a wonderful progression. Let's see, I got him on June 5th, and I patched him with the X39, the ice wave, and the Eon. And then June 8th, he had no more leaking. So he would eat and it wouldn't come out that hole anymore. So we're only talking a few days.
Wow.
And then by June 12th, the wound was completely closed. And then by the 18th, there was no scab. You could see in the skin where the puncture was, but it was more or less just, those last stages of healing. And we fell in love with him and ended up keeping him. So he's ours now.